Hi. Our topic is about inferring how one's lifestyle can affect the functioning of the respiratory and circulatory systems. Let's begin. Eating high-fat and high-cholesterol foods, nutrient deficiency, smoking, and sedentary lifestyle can result to various circulatory diseases. Circulatory system diseases can be classified into three: disorders of the blood vessels, disorders of the heart, and disorders of the blood. Let us first discuss the disorders of the blood vessels. First is atherosclerosis. It is a disease where plaque consisting of cholesterol and other substances are built up in the arteries. Smoking and high-fat diet contribute to plaque buildup in the arteries. These plaques in the arteries narrow the diameter of the arteries, which impedes blood flow. Next is the stroke. Stroke is a sudden loss of the brain function when the blood supply to the brain is cut off. Blood supply is cut off due to the blockage of the arteries in the brain or in neck vessels. Due to this, the brain gets deprived of oxygen, causing the brain cells to die. There could also be a blood clot within the blood vessels that can block the blood flow. Now let us discuss the disorders of the heart. Coronary heart disease is characterized by the inability of the blood to reach the coronary arteries of the heart. Atherosclerosis or aging may cause the thickening of the arteries, resulting in a low volume of blood flow. The reduced blood flow may cause pain in the chest, left arm, and damage cardiac tissue. Coronary heart disease may also cause heart attacks when cardiac muscle dies. Next is hypertensive heart disease. Hypertensive heart disease is characterized by chest pain, a pressure in the chest, shortness of breath, fatigue, and pain in the neck due to the thickening and enlargement of heart to force the blood flow through the tightened arterioles. When this happens, the heart may be unable to pump enough blood. It may beat abnormally or doesn't get enough oxygen. Another disorder of the heart is the rheumatic disease. Rheumatic heart disease is a condition in which the heart, specifically the valves, are damaged by rheumatic fever caused by Streptococcus pyogenes. Rheumatic heart disease is common to children. Some symptoms of rheumatic fever are fever, joint swelling, stomach pain, and some rashes. Rheumatic heart disease can be treated through the use of antibiotics to prevent rheumatic fever or surgery to repair or replace the damaged valves. Now let us discuss the disorders of the blood. First is hemophilia. Hemophilia is an inherited disease characterized by continuous bleeding and difficulty in clotting. It is passed by the affected mother to her male child. Hemophilia is caused by the lack of one plasmic proteins needed for clotting. To speed up the clotting sequence, anti-hemophilic factor, AFH, is used. Worst cases of hemophilia may lead to anemia due to continuous and excessive bleeding. Thus, transfusion may be needed for too much blood loss. Another disorder of the blood is anemia. Anemia is a condition where red blood cells in our blood decrease in count. This results to decrease of oxygen in the body tissues. Anemia can be either be inherited, caused by nutrient deficiency, excessive loss of blood, red blood cell destruction, or bone marrow problems. Eating iron, vitamin B12, and folate-rich foods, taking supplements, and sleeping for 8 to 10 hours can help prevent anemia. Other medications include radiation therapy and chemotherapy. Last is leukemia. Leukemia is a cancer of blood cells such that there is an abnormal increase of white blood cells. Huge and numerous white blood cells are produced, taking the entire space while giving only a little space for red blood cells and blood platelets to grow. Common symptoms of leukemia are pains in the bones or joints, fever, loss of appetite, discomfort in the abdomen, and bruising easily. Leukemia is usually treated either with chemotherapy, radiation therapy, or bone marrow transplantation. In summary, we have learned that the functioning or our circulatory system is affected by our lifestyle. Most circulatory system diseases are caused by high fat and high cholesterol diet, nutrient deficiency, sedentary lifestyle, and smoking. The diseases of the circulatory system can be classified into three: disorders of the blood vessels, disorders of the heart, and the disorders of the blood. This is the end of the presentation. Thank you.